QualiSure Diagnostics develops molecular tests that help clinicians to personalize treatments. We introduce Thyroid GuidePx, the first genomic classifier for papillary thyroid cancer. Thyroid GuidePx is a prognostic test that refines and simplifies risk stratification, helping clinicians to personalize treatments, deciding on the best, most appropriate clinical management. Recognizing who is unlikely to recur helps to identify candidates for less extensive surgery, to identify who can avoid unnecessary radioactive iodine, and to recognize who can have less intensive follow-up. By de-escalating treatments in an informed manner, healthcare costs can be saved and, importantly, quality of life can be preserved. The incidence of papillary thyroid cancer, the most common form of thyroid cancer, is increasing by more than 6% per year in many countries. What makes papillary thyroid cancer unique is that it isn't life-threatening most of the time. However, its clinical behavior is dichotomous. In most cases, the tumor is indolent and responds well to treatment, but behaves more aggressively and recurs in about 10 to 15% of instances. Identifying instances where recurrences are much less likely is integral to clinical decision-making. The most common method for estimating recurrence risk is the American Thyroid Association Risk Stratification System, which classifies risk as low, intermediate, or high. However, the ATA system does have some limitations. First, it's complex, including multiple variables, some of which are subjective or require detailed pathological examination. Importantly, there is a need for improved accuracy, especially in identifying individuals with a very low risk of recurrence. Thyroid GuidePx is a genomic classifier for papillary thyroid cancer. The test consists of a panel of 82 prognostic genes that classify papillary thyroid cancer into 3 molecular subtypes. In conjunction with tumor size and lymph node status, the test identifies a patient subgroup with a very low risk of recurrence. This simplified approach outperforms the ATA risk stratification system, and appropriateness of care is enhanced. Appropriateness of care is giving the right treatment to the right person at the right time. It's what we strive for.